I want to thank our distinguished speakers. As you can hear, that the complexities of elder abuse, in the community setting, the social culture context, and I think I'm often cautioned by not only research practice but policy when we think about this vast complex issues in a global sense, without considering at least some consideration of social and cultural issues in study design, in study implementation, understanding, in statistical analysis, interpreting of data results. So I would like to open for questions, please. Yes, Fran.
Fran Henry, forum member. And this question is directed to the panel as a whole. It may be more relevant for the, well, I'll just leave it like that. It's the panel as a whole, you might have different perspectives. But I heard yesterday that we're not wanting, certainly we're not wanting to blame the victim of elder abuse, but is there room to ask whether the person who's now the victim was at one time or possibly still is somebody who harms others, and how we deal with that complexity either in a cultural context or more broadly. And specifically, when we're doing prevalence studies, is there a chance to ask, or could we be creative about asking, have you ever been victimized? But not only that, have you ever victimized others? Have you ever harmed others? To, make this more of an aspect of humanity, an aspect of familial relationship, an aspect of the complexity that it seems to me that an awful lot of violence is. Thank you.
I'll take a stab at that one first. I'll start with the last question first. I think there is room. I think more and more studies are now starting to address the issues of violence. For example, the children's study, but it's behavioral risk factors in health or something. BFH. Yeah, that one. Asked the Adverse Childhood Exposure Questionnaire, which is the questionnaire that's starting to be used a lot in epidemiologic studies. We need to develop that kind of instrument to talk about exposures in general, that talk about adverse exposures, not just in childhood, but adverse exposures across the lifespan, that allow us to capture those exposures now and then link them to other health effects and other areas of concern. So that, I think that's something that's happening. I think the issue of abuse across the lifespan, intergenerational violence, gets captured when you start asking that kind of question. I guess the issue of victim blaming is one that we have to deal with. But I think as we start to deal with how we cope with situations of conflict and handling them in a nonviolent fashion, then I think we can perhaps get to what you're talking about.
Thank you for your question. I think it's really right on, and it's something that I think I've heard discussions about quite a bit in Native communities, that sometimes this is payback. And not to say that it's always that way, but that does happen sometimes. And so I think it's worthy of some investigation.
Yes, Alex.
Thank you.
I'm sorry.
Sorry.
Iggy, go ahead.
Sorry.
No, it's okay. I just wanted to jump on that. And also, especially addressing this from the Chinese community perspective, most of the abuse situations that we have captured definitely happen in the family context. So as part of, to expand our Cure and Pine study, we also wanted to address this violence aspect from the perspectives of our adult children. So we're expanding this to really build in the intergenerational perspectives to ask adult children what their perspectives of filial piety are there. Have they ever been abused when they're growing up as children, and to really pair up their diet. And hopefully that will give us some useful information and could address your question more appropriately in the future.
Yeah, Frank, just imagine, it's very hard to have someone to consent to say, if you say that you abuse someone, we're going to have to report you. The filial piety study, some of the things Dr. Yang spoke yesterday about this construct called proclivity to elder abuse. It's a construct where you can measure but does not have the reporting issues that often occurs. I'm sorry, yes, Alex.
Thank you. I would like to make a comment and then ask a question. The comment is, this is a session that is talking about the role of community. And I just want to inform one thing that it's very important, in my opinion, which is the role of activism and the media. Anyone that would be familiar with the Brazilian culture, but that applies mostly to the Latin American region altogether, we understand the role and the importance of soap operas. Brazilians are addicted to soap operas. And at the prime time, you may have up to 50, 60 million people following the dramas, the sagas. And one of the most interesting and creative events that we have seen in relation to raising awareness to elder abuse was when the Globo television, which is a powerhouse in terms of media in Brazil, introduced in the script of one soap opera elder abuse. And it was this perverse granddaughter that was abusing her grandparents. The country stopped, and elder abuse became in the forefront, and everybody was discussing about elder abuse. This is about 6, 7 years ago, and the Television Globo network hired a very good friend, many of you know Laura Machado, a gerontologist, that was in charge of bringing the content. And the soap operas in Brazil, they are written as you go. And because this became fascinating to the public, it went on and on and on. I spoke to the actress who was the perverse grandchild, and she said that I cannot even go out in the streets. People are abusing me. And I tried to explain, it's the character, it's not me. So really important for us to observe, because in Latin American context this is very important. And the questions to my dear friend Javier. We have seen tremendous, tremendous progress. And as you pointed out 10 years ago, when we were trying to bring a rights-based approach to health in WHO, there was a lot of opposition. People couldn't understand that. It was away from the realm of doctors and health professionals. And we have seen all the progress that you are reporting. I wish, though, that other regions would have done as much progress as Latin America has done. I have my explanations for why this region has done so much more progress. But I would like to ask you, Javier, because the reason we are not making much progress at the global level is because there is an opposition from a certain number of countries. And I have no hesitation to name and shame, mostly from European countries. And you have stressed a lot the role of Latin American countries, Latin American, Caribbean countries. Again and again you have expressed that. What has been the role, I want to be very open about this, after all, we have to be transparent if we are talking about abuse and rights. What has been the role of the US and Canada in this regard?
Thank you, Alex, for your question that has, I think, different components. The answer. Number one, I think that in the Inter-American region, in terms of the Inter-American system of human rights, that is one of the strongest in the world, with the Inter-American Commission, the Inter-American Court of Human Rights. That has been a great, great advantage for the rights of older persons. And I think that the role of civil society, bringing these issues to the Inter-American system of human rights and bringing these issues to the media in the countries, and also organizing capacity building on the rights of older persons in all these countries, I think that has been certainly an advantage of this region. From the point of view of the Pan-American Health Organization vis-a-vis the other regions of the World Health Organization, I think that one advantage has been the negotiation and approval of several resolutions and technical documents on health and human rights by the Directing Council of PAHO and by the Pan-American Sanitary Conference of PAHO. For example, it was in 2002 when for the first time all PAHO member states, including Canada, the United States, Central, South America, Caribbean, approved a resolution on aging, introducing human rights sections. And more recently, all PAHO member states approved a resolution on health and human rights, addressing the importance of using human rights treaties and standards. So I think that also had to do with the leadership of the Secretariat in PAHO and all the directors in PAHO who certainly have taken human rights and health very seriously and have seen the advantage of using human rights treaties and standards when in technical collaboration and for the reform of policies, plans, and laws. And aging has not been an exception. And in the development of the Inter-American Convention on the Rights of Older Persons, the United States is participating in the working group and is also giving ideas during the discussions. The United States and Canada have expressed their reservations to the process because there is a global process going on in the United Nations. There is a working group in the United Nations. We don't really know what are going to be the developments in the United Nations and what are going to be the outcomes. So the United States and Canada have said that they will wait to see what are the outcomes at the global level. But they are participating in the working group and also providing ideas, information, and documents to the group. But I think that what is remarkable in this region, and I think is going to be also a great influence for other regions of the United Nations, is that once that instrument is approved, we finally will have a very unifying instrument on aging and human rights. As I mentioned in my presentation right now, the norms and the standards and the provisions are very, very dispersed. So this Inter-American Treaty is going to become a conceptual and legal framework that is going to organize all these issues. It's going to organize all these human rights in the context of aging. And it's going to help also the United Nations developments.
Thank you, Javier. For time's sake, let's keep our questions, and we want to get as many as we can. Go ahead.
I'd like to first thank the speakers. I thought that was quite a stimulating group of talks. I'll follow up on that point. I think both for child abuse, for interpersonal violence, and for elder abuse, we're talking about culture change. And culture change, you have to have a stick and you have to have a carrot. And the stick is having the human rights and these framework policies that define what abuse is in a sort of hard, solid definition. But when you get to communities, it often doesn't match with what they think of it. And so the carrot is qualitatively working with the community and getting them to say, maybe not what abuse is, what they think good quality care is for the Chinese or for the Indian communities, and having them define it, and then buying it, having them make those statements and having them involved in the process of improving the quality of life of the elderly and buy in, and then maybe moving them closer to what this international absolute goal is of what we think of abuse is. But you can't, they're not going to buy into these models that have been defined at some meeting at a big an international organization. They're going to buy in on what's valuable in that community to their culture values. So you've got to have both the stick and the carrot. And where's the balance? And for example, if we're talking about institutional care, there also is have we done qualitative studies of what the providers in those institutions think is quality care? Or you say, this is what you have to do, you have to check this 3 times a week, you have to make sure the drugs aren't more than that. Is that really what's going to work? Or is it changing the culture in those institutions? What do the providers, these underpaid health aides who have to provide care, what do they think is good care for these elder that they're working with? And see, what could they do to make it a bit better? And then work with them once they feel that you're on their side, work them to move towards what we think these absolute goals are and absolute definitions. If we try and do it just one side, we're not going to get anywhere. I don't know if that's really a question, a statement, but I wonder if you have any responses to that.
I don't know if I have the answer for the question, but what we are observing in this process is that the what was understood as elder abuse before the human rights-based approach is changing. Because one question that we have is if all these practices and flaws in policies, plans, and laws that are not the traditional elder abuse are not causing the same effects on older persons than the traditional elder abuse that happen in long-term care facilities. If there is no access to water, as we see in many communities that affect older persons, or sanitation, or if health information is not in the indigenous languages, or if there are no laws and policies to review a guardianship and legal capacity, and the person cannot exercise all their rights. I think that what is happening, and perhaps I'm mistaken, but is that the conceptual and legal framework of elder abuse is becoming bigger. And it's becoming bigger because when we put it in the context of exercise of human rights, then the effects on the health and integrity of the older person is gonna include other areas that are not only constrained to a long-term care facility.
Laurie has something to say? A quick answer, yes.
Well, I think you're absolutely right. But another thought that occurred to me is that there's a difference between the long-term care setting where certain things just have to happen. And it's, to some extent, although I agree with the qualitative research on what people think, how important that is, there's a line. Certain things have to be done. I think I'm starting to think there's just so many different types of elder abuse that we're talking about here. There's not just one type of elder abuse. There's not just one answer. There's so many different conceptualizations. Are we even talking about the same thing? And I think that's where we really need to, that's where the struggle really is. And
Culture change.
we are.
Would you agree?
I absolutely agree. I think you said it very well.
Charles, quick response.
I just want to add to something you said. I think you're right in talking about it as a culture change and talking about the quality care, but I would argue that what we're really talking about is a shift of valuing the older adult and figuring out how to get the value of an older adult to anyone's society paramount.
Dr. Teister.
Thank you. I want to, again, as Dr. Phillips said, congratulate the panel. Very stimulating, and add on to what you have said. Any of us who have studied organizational culture knows that culture eats legislation and regulation for lunch, and we need to remember that. So I think, but I think we need that. We forget that to our peril on this, and so. I guess what I want to go back to is something Elizabeth said yesterday and that was mentioned this morning by Greg, and certainly in all of your presentations it permeates there. It's this idea of creating an ethos that promotes the right treatment of individuals. How do we create the ethos? We certainly can sue. We certainly have legal provisions. I would not ignore that. My husband would be very sad to hear that I would say that. He'd be out of a job tomorrow, so the Teisters would not eat. But what I do want to say is the importance of creating this ethos of right treatment and respect. So we return to this, and I believe Elizabeth nailed it, and Greg again, when we talked about the kids. Okay, we have sporadic attempts to deal with this issue. Every one of us has been one at one time, and many of us have them, one way or another. We have made sporadic attempts, which are sweet and lovely, and I'm not denigrating them. But I think we have missed a wholesale way to begin to change an ethos for, and if anybody else is not pretty excited about this, I'm thinking I want to be an elder. And so I want to be a safe one. Okay? I want that for older adults, for myself and my progeny. So I guess I'm thinking, what we need to do is think of ways to change the ethos, and we have a marvelous intergenerational opportunity, but we're doing it only sporadically and in pockets. So how do we change the culture in the macro sense. That's a piece. And it may be different in different cultures, I acknowledge, but the idea of it is not different. The idea, in fact, has been something we need to think about. So I'm done.
Any responses from our panelists?
I just have one last word I want to maybe insert into the conversation, which hasn't come up that much in the meeting so far, and that is ageism. And in so many cultures, I don't want to say all, but ageism really is an issue and is such a huge part of this. So I do want to sort of put that into the conversation in terms of not so much why are people abused, but why isn't more done about it? Why isn't this a bigger issue? Why does this command more attention publicly?
Charles?
Yeah, I just wanted to have, I had a thought that I wanted this group to grapple with. I think all you said is true, that we have to change the ethos, we have to change the culture, we have to change how we think about this. But I'm leaving here in about an hour and a half to go to a meeting in Minnesota of the Academy on Violence and Abuse. If you don't know about the organization, please check it out at ava.org. One of the founders, Jackie, is sitting there. And what I've noticed, this organization looks at child abuse, intimate personal violence, and now it's trying to look at elder abuse. And what I found is that, at least from my child abuse colleagues, they have successfully changed their world. And they've changed their world with good research and data and pinning down what the problem looks like for the average healthcare practitioner, the average individual in the community. To a certain extent, what we're talking about is a inability on our part to define what this looks like, but B, have the willingness in this society to say that it's wrong and we're going to step in as a group to fix it. We have the problem, which I'm sure the ethical groups must have talked about, the problem of independence at the age of maturity. My child abuse colleagues don't have to worry about that. The child becomes a charge of the state, and we intervene. Until we figure out how to grapple with that ethical issue, we're going to be stuck.
I think we'll take the last question. Is there a question over there on the right?
No.
Oh, no. Okay, we'll take that very short question and we'll take a break. Thank you.
Thank you.
Oh, we'll take two. How's that? Go ahead. Pithy comments.
Thank you. Linda Kincaid with the Congress of California Seniors. When we're discussing rights of elders, I think it is crucial to include the right to visitation. In California, we have many long-term care facilities that will restrict, or in some cases, completely deny all visitation and phone calls to their residents. And advocates have taken this issue all the way up to our director of DSS at the state level. And his position at this point in time is that a conservator or guardian has absolute right to control visitation, including completely isolating that person from family and friends. So we have a lot of policy work to do in this area.
Thank you for your comment. Jackie, your last thoughts?
I can save most of mine for ways forward if you promise to recognize me then. And but I just wanted to say I thought this was a fabulous panel. I am just buzzing with thoughts of how we can do what Fran talked about at the beginning, closing down silos more while at the same time bringing the attention to elder abuse the way we should. Some of the concepts of the notion of restorative justice, I think, are incredibly important here. Some of the concepts around historical trauma and how that has now intersected so many of the indigenous groups were stripped away, sent to boarding schools, abused in various ways. Those folks are now the grandparents who are raising kids, severely traumatized grandparents who oftentimes abuse their own children which is part of the problem, that those children are not caretaking their own children, and they're being given back to grandparents without that trauma ever being addressed. And I think, you know, some sorts of restorative justice, of course, being very careful, those kinds of models have great promise in order to make communities take this on. You know, if they're responsible for meting out the justice, which is oftentimes very complicated, it does bring awareness to those communities. So I think there's lots of exciting things we can take forward.
Absolutely. A house with the stronger foundations and the trees with the deeper roots. And I think that's very much, thank you very much to our panelists for being here today. Thank you. We'll take a short 5 minutes break, and then we'll come back and resume. Thank you.